Hello, everyone. Welcome. I am Amita Sharma, co-founder of Nourish Doc. We offer prevention-based wellness programs in natural and holistic medicine that are delivered by our curated experts. Our wellness programs are backed by research, science, and outcomes. In our Q&A session today, we are going to talk about how Ayurveda can safely treat anorectal disorders. To talk about this, we have Dr. Vaidya Kulkarni, an award-winning Ayurveda doctor who has treated thousands of people with anorectal disorders using Ayurveda therapy. Welcome, Dr. Vaidya.
Namaste, excited to join from India, and it's 7:31 a.m.
Well, we have to say 1 minute afterward.
That's true. All right.
All right.
Thank you very much for joining me.
Absolutely. So we are going to ask you a few questions, and if you can talk about what exactly is anorectal disorder and what are the common symptoms?
Yeah. So anorectal disorders, it means that the diseases which are occurring in the region of anus or rectum. That's why they are termed as anorectal disorders. The number one disease which tops the list is hemorrhoids, or so-called as piles in the layman language, which is very common condition. And as we have already told that approximately 10 million people would be affected with this every year. And as per one study estimation, more than 50% of the US population over age 50 years have experienced hemorrhoids once in their life. So again, we have grades in the hemorrhoids. It may be 1, 2, 3, and as per some classifications, it is 4 also. The second common is anorectal fistula, and the third is anal fissure. Though anal fissure is much more common than hemorrhoids, but anal fissure is a disease which can resolve easily, whereas hemorrhoids needs little bit more efforts in with respect to management or in order to treat it. And then we have the rectal polyp or the anal polyp, so which can be a kind of carcinogenic kind of polyps. So even we need to excise them when it comes to polyp treatment. So basically, what I want to tell is, one is piles, then is fistula, anal fissure, and polyp. These are the 4 conditions which we usually see in our clinical practice. When it comes to the common clinical features or very evenly seen clinical features, then pain or burning sensation during defecation or just after defecation or 2 to 3 hours after defecation is one of the prime clinical feature with which, or the complaint with which the patient visits the clinic. And then this all happens due to constipation. Most of the times it happens due to constipation. Then sometimes there would be a mass per rectum, that is either it is outside itself or it comes out, pops out during defecation and goes inside. And then the discharge, wherein it can be pus discharge if it is anal fistula or anal fistulae. It can be mucoid discharge if it is hemorrhoids or even if it is anal fissure. Bleeding per rectum is also one of the very important clinical feature when it comes to anorectal disease, because if it is painless bleeding per rectum during defecation, then we usually go to piles as a provisional or the clinical diagnosis. If it is painful bleeding per rectum during defecation, then we go to anal fissure. And usually in the fistula, we see the soiling of undergarments with either pus, that is purulent soiling, or else sometimes it is mixed with the blood, but not exactly the bleeding that we don't appreciate or see in the anal fistula. Itching is also one of the symptom or the clinical feature because of the mucoid discharge which is seen in the piles. So sometimes there would be lots of itching also, which causes discomfort to the patient, and hence the patient runs to the clinic or the OPD immediately.
I see. So what are the common treatment techniques according to the modern system of medicine? You know, if someone doesn't know about Ayurveda technique, yes, what do people do right now? I mean, what is their first line? I mean, do they go get surgery or what do they do?
Yes, as of now, for example, for an instance, I'll take a case of anal fissure. Anal fissure is nothing but a linear tear in the anal canal or at the verge of anus because of usually hard motions, that is usually constipated bowel. Sometimes it may be because of loose stools also and some other underlying diseases. Most of the times it is because of hard stools or constipated bowel. So what happens here is it would be treated with little bit of analgesics, little bit of anesthetic gels and local application, and then the sitz bath. So if it is not resolving at this point of time, then definitely they opt for surgery. So they then just go ahead with surgery. When it comes to anal fistula or anal fistulae, which may be a primary or a secondary disease, or because of some underlying diseases also, like maybe tuberculosis or HIV, if it is multiple fistulae, then definitely most of the times we have surgery as an option in the contemporary science. Again, in the surgery, we have lots of techniques. It may be a laser one, or it may be fistulotomy, fistulectomy, for fistula I'm talking about, or it may be plugging. So all these kinds of techniques we have in the fistula. But surgery is almost an option when a patient visits the OPD and is being diagnosed by fistula-in-ano. Of course, it is backed with some of the investigations like transrectal ultrasonography or endorectal sonography or MRI fistulogram. So after this, then definitely it's all about fistulotomy or fistulectomy. So it's all about cutting. But when it comes to hemorrhoids, we can still, in the contemporary science, it's still being treated with some of the medicines in the grade 1. Of course, diet and lifestyle changes are a must in all of the anorectal disorders. Corrections, it's required. And in the hemorrhoids, stage 1 till stage 2, then it's fine. Then if it has crossed stage 2, then definitely surgery is the only option which is left. And anal polyp, irrespective of anything, it's always good that we just excise it, we just remove it and send it for further investigations, may it be like biopsy or the histopathology. Definitely, because this is one of the therapy, or this is one of the field wherein Ayurveda has always topped the list, the treatment aspects. And here today I want to talk about Kshassutra, because it is one of the hallmark of Ayurvedic surgery. And for those who feel that Ayurveda has no surgery, please note it down that Ayurveda has surgery, and so there is a master's and the doctorate in Ayurvedic surgery also. So it's definitely there. Of course, there would be restrictions for the surgery or the areas of the surgery wherein how general surgeon cannot operate for a neurological case, or he cannot become a neurosurgeon like that. Even Ayurvedic surgeon can also have some limitations, and then we'll be working in that limitation itself. So Kshassutra is one of the therapy which is the most discussed and which is the most effective in my practice, which I have seen. And we can just term it as a minimal invasive parasurgical Ayurvedic procedure. So of course it is a complete kind of surgery itself, but there is no direct cutting involved here, very minimally invasive. And of course we just go ahead with this with some pre-op tests also, as required. Pre-operative precautions we take, pre-operative tests we take, and then we just operate it in a hygienic OPD. So Kshassutra is one which I want to talk about today. And number one disease wherein Kshassutra works effectively is fistula-in-ano. Number 2 is pilonidal sinus. And then sometimes some of the specialists, some of the Ayurveda surgeons practice it for piles also. So it's not ruled out. Some of them practice it for anal fissure also. So Kshassutra is the hallmark of Ayurvedic surgery, and it's very good and effective is what I'm telling, because it is not going to affect the routine of a patient. If at all a patient gets operated for fistula, which is usually fistulectomy, then there would be lots of hurdles for the patient, wherein the patient would be losing the routine, daily regular regime, and then have to visit the hospital for dressing, for just checking the recurrence, for checking the wound dehiscence, keep on checking it, and then dressings, lots of dressings will be going on. So, and then healing also takes time, wherein if we go ahead with Kshassutra, it's just a kind of daycare surgery or day case surgery, wherein we can just proceed with the procedure, finish it off, and then every week we would be changing the thread, because Kshassutra here means, I'll be explaining it in the next slide. Kshassutra here means medicated thread therapy, wherein, yes, we have 3 coatings usually. Of course, we can use different kinds of Kshara or different kinds of herbs here. But what I have taken here is a standard example of Ksharasutra, wherein we have Euphorbia latex, Apamarga Kshara, and then the turmeric. So all these 3 combination we will be having as a coating on Ksharasutra, and then it is prepared methodically. So Euphorbia latex, it is a proteolytic in general. All the 3 does the same thing, but to be specific with their action. So Euphorbia latex is a proteolytic and which helps to dissolve the fibrous tissue of, it may be fistula or even it may be pilonidal sinus. Whereas Apamarga Kshara is again a alkali or a alkaline herbal paste or powder which helps to clear the tract, and even if there is any pus, it will just drain the pus or liquefies the pus, and also acts as an antimicrobial. Of course, turmeric is a well-established anti-allergic, antiseptic, anti-microbial herb which you have always seen, and of course for wound healing also it's very much required. So these things make Kshara stand top in the list as of now for fistula-in-ano or even for pilonidal sinus.
So I think most of the viewers would like to know whether it is safe, to do Kshassutra, an option to surgery. What are the advantages? So maybe you could talk a little bit about that.
Definitely, it is one of the frequently asked question, FFAQ. So definitely we have to talk about it, and
okay, that's good.
People will have a confusion in their mind. And sometimes what happens is, because they have been told about the surgery, they'll be half of their energy is lost there itself by hearing that they have been advised surgery. So what here Kshassutra does is, even though it's a parasurgery or even though there is a cutting involved, which is not physical but through the thread, we can go ahead with the procedure almost without antibiotics. Fine. We can just go ahead with a tetanus injection and then just go ahead with the procedures. Usually we don't involve antibiotics here.
You're saying no antibiotics is needed for someone who...
No antibiotics needed, provided if the fistula is primary. Like fistula can be because of maybe diabetes mellitus. In the diabetes mellitus, immunity will be low. They develop anorectal abscess, which turns into fistula-in-ano. There we may have to think about antibiotics, but in general, usually we don't prefer antibiotics. Instead of that, we have Ayurveda medicines, formulations, which I'll be talking in the subsequent slides about the medication. So which will act wonderfully, and they are proven also. Not like I'm just talking it based on my clinical experience. It is proven also. We have lots of papers published out of it in the research journals. And no antibiotics is one of the things. Second is if at all a patient is having underlying disease also. See, for example, if a patient is diabetic, uncontrolled diabetes mellitus, uncontrolled sugar levels, blood sugar levels, and if they opt for surgery, either they have to be dependent on insulin and then they have to opt for surgery, because during the surgery it's very much mandatory that the sugar levels are normal until and unless it is very much emergency surgery. So when it is elective surgery, we have to be always keen on maintaining the sugar levels and the blood pressure levels. So if it is not there, then the wound is going to take lots of time to heal. There may be high chances of recurrence. So whereas when it comes to Kshassutra, with their normal routine itself, with their normal anti-diabetic or anti-hyperglycemic drugs, whatever they are on, along with that, we add a few of the formulations and then we start with the Kshassutra therapy. Of course, if it is required, we definitely refer them to diabetologist for the second opinion or to control the sugar levels, and then we just go ahead with Kshassutra. So this is one case which I want to talk about, safe in patients that have chronic conditions. So diabetes mellitus is a chronic condition wherein there are all the possibilities that there can be development of anal fistula. Same thing applies to tuberculosis also. Maybe any tuberculosis.
Oh,
yes.
People who have diabetes would be more prone to having anal fissure, is what you're saying, right?
Anal fistula.
Anal fistula. Okay.
And
I see.
When it comes to cost effectiveness, again we have upper hand here because it is very much cost effective. So it's a kind of affordable program, affordable parasurgical program. And Scar formation is also minimal. We can just see like there is one cut, kind of only one cut, and which is sutured kind of scar post healing I'm talking about. And
Okay.
it's completely made up with herbal pastes and herbal medicines called as Kshara, or the alkaline substances. 95% success rate is on paper, but practically and clinically it is around 98.5% success rate. On paper it is 95%, but practically it will be 98.5%. And recurrence is again negligible, as we have mentioned. It is around maybe 2%, not 3 or 5%, 2 to 5% it may be there. And main important thing when it is compared to surgery, and when what people have a fear in their mind is anal incontinence. It may be flatus incontinence, wherein they are not able to control the flatus or the gas which is passing out. The second one is feces incontinence, wherein if there is severe sphincter damage, then a person may not be able to hold the feces, the defecation urge, so it may pass off anywhere. Yes. So these are the two. One is flatus incontinence, one is feces incontinence. When it comes to Ksharasutra, what we have seen post Ksharasutra endorectal sonography is minimal sphincter defect is or minimal sphincter deficit is what they mention, wherein it never affects the continence of that person. So they can go ahead with Ksharasutra by all the means. If it is performed methodically, then there would be not so much damage when it is compared to surgery, that it may cause incontinence. I'm not telling that surgery may cause incontinence, but definitely yes, because fistulectomy is one of the procedure wherein we have to break the rule of minimally invasive technique. Here we have to cut more. When it comes to fistulectomy, that is the surgery, we have to cut more in order to, or we have to dissect more, we have to excise more tissue in order to prevent the recurrence. So because of this, the healing also affects. It will take time because of more cutting. And sphincters also get damaged, and because of this, there may be incontinence. Whereas in Ksharasutra, how much ever is required, that much only is cut. Of course, there is one technique called as fistulotomy, which is only the cutting of the tract. But with this, there are lots and lots of chances wherein we can see the recurrence. So we usually don't practice it. If it is surgery, then fistulectomy. If it is Ayurveda, then it is Ksharasutra. So even I have made lots of videos on this also, which are on YouTube, wherein we have compared medicines with surgery in fistula. The first step, whether it can be cured with medicines or it can be cured with surgery. There I have mentioned that cure word for fistula-in-ano is a misnomer till it is treated completely. Okay. So this is one thing. And when it comes to...
That's excellent. Yeah. Then I'm wondering if...
Yes. When it comes to, again, anal incontinence, so fistulectomy may cause anal incontinence most of the times. But Ksharasutra, it may show sphincter deficit, but it is not going to cause incontinence.
I see. So could you talk about, like, I think this is very insightful and quite technical, I would say, that for a normal user, and I'm a normal user. So maybe you could talk about a success case, any success case and outcome for our viewers, so they can understand in a layman's language, if someone is suffering from anorectal, what is, what the complaints were and what did you do and what were the results?
Definitely yes, because this has been mentioned in my book also. In my book, we have a success case story with respect to fistula-in-ano also, wherein a patient had visited the clinic or the OPD with severe pain and pus discharge from the perianal region. When we examined him, we had seen that the abscess was burst open, the perianal abscess, and then it had turned into fistula-in-ano. After series of investigations, maybe the pre-op investigations and the transrectal ultrasonography, we confirmed the presence of fistula-in-ano. So the complaints with which he visited was maybe pus discharge, and then the pain, the continuous picking kind of pain because of the pus. And his appetite was normal, micturition was normal, bowel movement was altered. Of course, we see these altered bowel movements in the fistula-in-ano, and sleep was normal. And what we did was we directly jumped to the Kshassutra procedure post-analysis. We analyzed him, and then he was around 28, 29-year-old. I still remember his name also, which I'll not be disclosing now. And we started with the Kshassutra procedure, wherein it went for almost 6 weeks. So we had to go ahead with the 6-week procedure. Little bit pain was involved here. I'll not disagree with this. Little bit pain was involved in the whole procedure, and along with that, we had given him Trifala Gugulu, 1 tablet TID before food with water, and Gandhaka Rasayana, 1 tablet TID before food with water, which was prepared from one of the esteemed pharmacies known as SDM Pharmacy, Udupi. So we had given these kinds of medication, and then after 6 weeks, the track was completely cut. We reconfirmed it with the TRUS also, transrectal ultrasonography. The track was no more existing. The fistula was no more existing, and it was reduced because sometimes after some days of the treatment, we usually go ahead with the investigation. We don't do it immediately. So if we do it immediately, then we may get the result that the fistula-in-ano is still existing. So once it is completely healed, then we go ahead with the investigation. So totally it was 6 weeks, and in the 6-week time, usually around 4 to 4.5 weeks was the treatment, and healing took around 10 to 14 days. So totally 6 weeks, and level of pain was also subsided considerably. And the first discharge initially for 1 to 2 weeks it was more, and then it reduced drastically, and the pain also reduced drastically.